and welcome to Trendlines, a podcast on global affairs brought to you by World Politics Review. I'm Elliot Waldman. Before we get started, a quick note to our listeners that if you like what you hear on Trendlines, I hope you'll consider supporting our work by subscribing to the show or even leaving a positive review. We'll have a full transcript of this episode available later on, so to access that, just send an email to podcast@worldpoliticsreview.com. And if you'd like to explore all the other topics we've covered in the past, you can find a full archive of the show at worldpoliticsreview.com/podcast. In recent decades, scientists have identified dozens of new, potentially deadly pathogens that originated among other animal species, but have the capacity to infect humans. SARS-CoV-2, the virus that causes COVID-19, is one such zoonotic virus, and our vulnerability to them is increasing as a result of human population growth, globalization, climate change, and other processes. My guest for today, Dr. Deborah Kochevar, is the director of a recently launched project called STOP Spillover, which aims to anticipate and address the threats posed by zoonotic pathogens. She's also Dean Emerita of the Cummings School of Veterinary Medicine at Tufts University, and has a Doctor of Veterinary Medicine degree from Texas A&M University, as well as a Ph.D. in cellular and molecular biology from the University of Texas. Dr. Kochevar, welcome to Trendlines.
Thank you for having me.
SARS-CoV-2 has become one of the more well-known zoonotic pathogens, but there are dozens of others that have emerged just in the past few decades. What factors are driving this recent spike in zoonoses?
I think there are a lot of factors that are driving the spike, and I think it's very useful to consider something that we call the spillover ecosystem to try to understand why that's occurring. And so when you think about an ecosystem, you think about interacting pieces. And in this case, we think about the pieces that articulate, that eventually lead to spillover. And so, for example, some of the factors that are really important in spillover have to do with drivers like urbanization, climate change, the instability or areas of conflict that might change the environment, food security, agriculture and land use. All of those are factors within an ecosystem that tend to change it. And for example, with climate, you can imagine that as climate shifts, then the pathogen range may shift, a pathogen being, for example, a virus. And so it alters the ecosystem and it shrinks the habitats in many cases. And the key outcome of that is that it puts various pathogens in more direct contact with people. And when that happens, the chances of spillover of the virus to people increases.
Now, what are some other notable instances of spillover that we've seen? Obviously, COVID-19 is the one that everyone's familiar with, but can you talk a little bit about some other well-known examples and sort of how the drivers that you just talked about relate to those cases?
Sure. I think one other concept that helps to understand why we're seeing so much of this is really an idea called One Health. And that's the notion that there is really no dividing line between the health of people, animals, and the environment. And those animals can be wildlife, they can be livestock. Obviously, people live in urban and rural settings, and the environment is something that's shared across all of those living organisms. So when we start to think about the factors I mentioned before, and then bring a One Health mindset to that, then you can imagine where some of the systems may start to break down. So for example, with wildlife trade, there is a legal and an illegal wildlife trade. In all cases, human beings become in closer contact to these wild animals, many of whom harbor viruses that are zoonotic, that move from animals to humans. So the greater the wildlife trade, the increased the risk. The same is true in terms of extractive industries. For example, we think about mining. And if you're mining in the far reaches of the Democratic Republic of Congo, then you may in fact be subsisting on bushmeat. You may be hunting to help to basically derive part of your food supply. The more hunters and gatherers go into the forest and disturb it, the greater the risk of exposure for them. The same is true when you think about encroachment of farm use or land use in the way of farming on conservation areas. And so as deforestation occurs in those areas to accommodate farming, then you've increased the interface for those farmers and for the individuals clearing those areas.
For the purpose of background, can you just tell us how exactly we know when a virus has spilled over, so to speak, from the animal world to the human one? We hear a lot about the difficulty of ascertaining exactly how outbreaks like COVID-19 begin. So how is it that we know that it came from an animal?
We are able now scientifically to be able to isolate a virus from an animal, from a human. We're able to do a much better job today of characterizing that virus, especially in terms of its genetic material. And so in some ways, that genetic material, just as it is for people, is a fingerprint of that virus. And so our ability to do surveillance, to test samples, and those samples can come from people, animals, wastewater, the forest floor. And as we assess those samples, we can pick particular high-priority viruses. And in fact, in our project, in STOP Spillover, we're focusing on a subset of known zoonotic viruses that we know have caused in the past zoonotic disease. So we can do laboratory tests for those, and we can do a pretty good job of identifying them. Now, I should also add, there are thousands, millions probably, of unidentified viruses that are part of the global virome, which we, at this point, only know exists but have very limited other information on.
And so what are some of those high priority pathogens that you mentioned that your project is working on?
So we would start with perhaps viral hemorrhagic fevers, very familiar to people, Ebola virus, another Marburg. Both of those are part of our pathogens of interest. Certainly zoonotic influenza viruses. You'll think back to the bird flu outbreaks, 15 or so years ago. The coronavirus family is clearly the one that's top of mind right now, but it's not just COVID. You'll recall MERS and SARS. Those are both coronaviruses. We also are focusing on Lassa fever in certain parts, especially of Africa, and Nipah virus, primarily more in Southeast Asia and Asia. So again, that list is a subset, but it's one that's selected because of their priority in causing zoonotic disease affecting humans.
And talk a little bit more about STOP Spillover's model in trying to tackle these pathogens and prevent spillover from happening in the future.
STOP Spillover is a USAID funded project. It's intended to run for 5 years, and it's a global consortium led by Tufts University with the primary goal to understand and really address risks posed by these known zoonotic viruses. And these viruses, again, have the potential to spill over from animals and to cause outbreaks, epidemics, and pandemics. I think a key word in that is the word risks. That across our project, all of our objectives are aimed at strengthening capacity in countries to understand risk, to analyze it, to communicate it, and then to use that understanding to design interventions at spillover points, and we like to call those interfaces. Others perhaps would call that a hotspot. But to use what we know and to use our understanding of risk to intervene in risk. And then I think very importantly, to turn around and assess our intervention. Did it work? If it didn't work, how can we make it work better?
What do those interventions look like in the real world? Perhaps can you give us an example to help illustrate it?
Yes. And so I think first, people should start to think in terms of even in their own daily lives. What kinds of interventions, for example, did we all experience as part of the COVID pandemic? Well, one major intervention was wearing of masks. The second would be social distancing. But if you think about wearing masks, as straightforward as that may sound, it was actually a big behavior change. And so in certain areas, it was very difficult to have people convinced that they should wear their masks.
I know of some areas where it still is pretty difficult.
Absolutely. And so what underlies that particular set of interventions is really human behavior and our ability to change that behavior. So that's a key focus of our project, is to think in terms of human behavior change. But there are some other sort of straightforward interventions. For example, in Bangladesh, which is one of the countries where we'll work, they harvest from date palm trees sap, and they collect fruit from those trees. And so it was determined that the bats that roost in these trees would defecate, and the feces would fall on the fruit, the fallen fruit. And then when people would eat that fruit, they would be exposed to Nipah virus that was carried by the bats. So an intervention was designed to create a little skirt. If you think about for example, a Christmas tree, and the skirt that goes around the bottom just circles the bottom of the trunk, and that protected the fruit from the feces. That's great, and it works to a point. But what was found was a lot of people weren't using those skirts. So a project like ours would potentially include taking a known intervention, saying, how do we make it work better? How do we encourage people to use this intervention that is thought to work, and make it sustainable, make it part of their daily routine?
To what extent does that involve sort of using insights from behavioral science, kind of nudging people in order to get them to take up these interventions that, as you say, are available, but that people might not be familiar with, or just might not know how to use, or might be a little bit averse to?
Oh, I think it's very dependent upon that. And so perhaps it's worth mentioning that the consortium that's come together to work on STOP Spillover includes a range of expertise, and certainly among those areas of expertise are social behavioral change. And so we're fortunate to have infectious disease forecasters, epidemiologists, virologists, food and water specialists, risk analysis folks, certainly lots of One Health expertise. But social behavioral change is going to be an important part of our project, and is already an important part of how countries have learned to deal with outbreaks, to be able to communicate through trusted messengers to local communities where the exposure is occurring, and to help them adapt their routines in fairly simple ways sometimes that decrease risk.
What are some other rapid response measures that countries, even low-income ones, countries where, for example, the ability of people to wash their hands frequently might be limited? What are some things that can be implemented there to contain the spread of an infectious pathogen when it first emerges?
Yes, you've already mentioned one, just the notion of introducing easy ways for adults and children to adopt good habits of hand washing becomes really important. Others that are likewise important are ones that are simply based on understanding where pathogens come from. Again, understanding risk. And so, if we know that encroachment upon the forest increases risk, then helping people understand how they should dress. Should they have on personal protective gear to limit the exposure that they might have? Are there ways, for example, we know that wild rodents are important animals, reservoirs for zoonotic disease. Potentially just the way the household is kept in terms of storage of food and water. The same is true of bats. Bats that roost in the rafters of certain homes, and then excrement falls, again, on eating surfaces or actually on the food itself. And finally, in some areas, especially in peri-urban areas in parts of Southeast Asia, where, for example, guano farming, so guano, the feces from bats, is part of the economy, then backyard, if you will, guano farmers can be helped to understand how important their hygiene practices are and their protective clothing practices are.
I can't help but think about the closing scene from the movie Contagion, and I'll just note to listeners that I'm about to give away the ending, so spoiler alert. But there was the scene where you see the bat defecation fall into the forest as a result of the bat first being displaced by deforestation, then the pigs that the bat had defecated on being transferred to a restaurant, and the server, the chef who was preparing the pig, not washing his hands before shaking hands with patient zero. And I was so struck by that scene because there were so many links in the chain, so many places where some kind of intervention could have been made, and yet wasn't, and it was that sort of negative cycle that led to the outbreak.
I think that's an excellent example of a sort of a biological sequence, and I have also been struck with some examples where it is strictly our behavior, our cultural norms that are driving the risk. And so there was a wonderfully creative social campaign in a Southeast Asian country aimed at making the wearing of ivory not trendy, not stylish, or eating pangolin scale soup, that is not a point of pride because you have enough money to buy the pangolin soup, but rather now sort of something that might be shameful. And so it's intriguing how creative we're getting to try to get to the root of why do people seek wildlife consumption? And is it subsistence? Is it their eating habits, or is it culture? And we know that what drives part of the wildlife trade is not under-resourced people, but rather wealthy people who want to buy some of these products because it's a status symbol.
That strikes me as a really interesting and powerful tool, because you're taking the concept of stigma and essentially turning it around and adding stigma to something that is harmful so that people don't do it. So obviously COVID-19 is sort of the big one right now, the pandemic that everyone is concerned about, especially now with the emergence of the Delta variant. Based on what we know, what we've been talking about zoonotic viruses, and with the benefit of hindsight, what kinds of conditions would have ideally been in place to prevent the novel coronavirus from emerging, spilling over, spreading the way it did?
So it's a good question. Hindsight is always much better than foresight, but I think to have been able to understand a little bit more the spillover ecosystem and the concept of One Health, and appreciate where those risk points are would have been preemptive, and that walks back through the same areas that we've talked about in terms of interfaces with wildlife, land use, agriculture and farming, cultural practices. And so having understood those better would have helped. The idea that prevention is so much better than dealing with the pandemic once it's here. I think a huge part of that is communication in terms of rapid response. Once it's clear that there has been a spillover event, to now amplification and spread are in process, that the ability to communicate, again, from the local to the regional to the national level in a trusted way. And that's a complex equation where people are trying to move in to help contain an epidemic or a pandemic. And they're typically not the same people who are in the community all of the time. And so their ability to garner a response and trust from the community, I think, is an important prerequisite. And just like adequate healthcare systems are important prerequisites, simply communicating in a One Health mode across human databases and animal databases. We should know when there's a spike in either of those populations, because that is a bit of an early warning. I do think, we have created over the past 20 years, and I credit USAID with some strategic investment in One Health. We have created platforms within many low and middle income countries that are at risk for spillover. They're called One Health platforms. And the premise is that we need to always be linking human and animal and environmental health. So I think if we could strengthen those, had those been stronger, that would also help us be able to respond quickly and to understand how to prevent and not always be left reacting to this spillover.
We also haven't really talked much about climate change, although you mentioned it at the beginning as one of the key drivers we're seeing of increased spillover cases. Can you talk a little bit more about the linkages between climate change and zoonotic viruses, and how your project and others like it are trying to address that?
So environmental factors writ large, including climate change, they tend to have a destabilizing or fragmenting effect on habitats. And so when that starts to happen, and deforestation is certainly an example of that, then as I said, you start to see the shift in the range of a pathogen. And so perhaps now it is more likely to be at an interface where it can move into the human population. Certainly increasing urbanization where there's a greater population of people living in a smaller area, sometimes also related to climate change because their livelihood may have been impacted by loss of land, arable land related to climate change. So kind of shrinking of habitats on human side into more dense areas and the expansion of pathogen range outside of their normal habitat, I think both can be viewed through the lens of climate. I think an interesting feature of our project is when we think about the factors that can impact spillover, one of the first steps on our project is to do an assessment of a country and to ask questions about where the spillovers have occurred. Was there a seasonal variation in those? What other predictors might we see as early warning signs? And sometimes climate, temperature change, availability of water, all of those may give us hints as to where our spillover events are at highest risk. And so I think climate permeates, it's a cross-cutting issue across our entire project.
I wonder if from your perspective, you're seeing more linkages being made very clearly, both in the scientific community and in the media and just in general conversations between climate change and these kinds of animal-borne viruses, pathogens, and pandemics. In other words, is the pandemic that's happening now sort of adding momentum to the need to address the climate crisis?
I hope so. I think one of the key features, again, of our project is that it is intended to be evidence-based and driven by science. And so there are clear links between climate change and some of the things that we just mentioned in terms of habitat and pathogen range and human exposure. And so I think it's a very short step to say climate change increases risk. And if we are in the midst of a pandemic and we're searching for all the ways to prevent a next pandemic, the climate change and how to think about that is very much part of the equation.
With COVID-19, part of the issue also was that there was an initial attempt by officials in China to cover up or at least play down the severity of the new outbreak that they were experiencing. And still today, we see the issue of an independent investigation into the origins of the coronavirus becoming part of this wider geopolitical contest, with even the scientific community getting swept up and coming under pressure to take sides. How much of an obstacle do you see this issue of politicization as being to implementing the kinds of interventions that we've been talking about?
It's a good question. I think that at the level at which we work, a primary goal for us, and even thinking about the spillover ecosystem, is the role that government plays. And so when we move into a country to work on a project like this, then the government at the local, the regional, and the national level is a key partner. And so if we are able to establish that relationship around a science-based platform, around a science-based mindset, then I hope that helps lay the groundwork for the kind of communication that is less political and more science. I think that the only way that translates to a community, though, is to have trusted advisors who understand the science and who can help the community understand the science. That's where the sustainability factor comes in, and again, work with them to change habits. I think the extent to which these One Health platforms are important features, usually of the government. Those are usually part of the government, that they help educate government writ large about the importance of these spillover events. And so I know that doesn't obviate the possibility that facts or an outbreak will be misrepresented, but it certainly increases the extent to which people understand the science behind them. And I do think that helps. I'll just add, one feature of our project is to work with a company a private company that helps to increase the capacity for journalism, for reporting of science at the community level. And that by doing so, especially, for example, helping to engage women in that storytelling process, then you begin to create a level of understanding at that local level that makes communication sustainable and hopefully less able to be politicized.
So it really sounds like this initiative is one that involves a really diverse range of people, from natural scientists to social scientists, education experts, behavioral science, and even, as you just mentioned, journalism and storytelling.
Yes, and I would just say, there are a lot of projects right now that are rightfully focused on preventing, stopping, detecting spillover. I think some of the hallmarks of STOP Spillover are what you've just said, that we view the capacity strengthening dimension and the stakeholder-driven piece of what we do as the road to sustainability. And that's slower, it's less flashy sometimes than virus hunting, but it's absolutely, at the end of the day, what we feel like is going to make a difference in preventing sort of the next pandemic.
It may continue to be less flashy and less seen because, as we know, cases that are prevented don't really get into the spotlight.
Yes. But, you hope that somebody is running the numbers on all of this. And the idea that, that, like, I think it's been estimated $200 billion in economic output is lost due to pandemic zoonotic viruses. And if you then start to try to place value on human life, then that number more than doubles, probably comes close to tripling. And then when you look at the amount that's invested in prevention, it's just a tiny fraction of that. And so it's the right economic decision to invest in prevention rather than to scrimp on that and then pay when the pandemic hits.
Well, this is a field where there's still a lot that's unknown, but also one that'll be receiving, I think, a lot more resources in the coming years and decades. What do you see as some of the most promising veins of exploration for future research and future projects?
I think it's a really important question, and one that I hope that perhaps the hallmark of whatever research is invested in is the ability to coordinate and communicate across all the different sponsors that are rightfully keen to invest in this area. So I really hope diplomacy, One Health diplomacy, is part of the answer to that. But specifically, assessing spillover reduction targeted at these high-risk spillover events is we have to understand those better. Establishing interventions around forest conservation, wildlife hunting, biosecurity around farms and markets, all of those are absolutely areas where we need to understand more to design and then assess interventions adequately. We need to refine our assessment of how we detect and characterize viral emergence. And then certainly viral discovery to understand the breadth of potential pathogens. Right now, we really, even though it's under discussion and there's lots of literature, we don't really have a way to use genetic associations to clearly predict which viruses are going to spill over. We need more research in that area to augment what we already know. So I think all of those are areas that are important, and a lot of applied research as to how we accomplish effectively social behavioral change and sustain it.
All right. Well, I think we'll leave it there. Dr. Kochevar, thank you so much for joining us to talk about this really important topic.
Oh, thank you so much for having us. We appreciate your interest.
Debbie Kochevar is Program Director of STOP Spillover, a project that aims to anticipate and address threats posed by zoonotic diseases. If you'd like to comment on the discussion, ask a question, or even suggest a topic for a future episode, drop us a line at podcast@worldpoliticsreview.com. This episode of Trendlines was produced by me, Elliot Waldman, and edited by Peter Dury. Special thanks to Danielle Toran for assisting with our transcripts. You can follow the team on Twitter if you'd like. WPR's handle is @WPReview. I'm @Elliot Waldman with 2 L's, 1 T, and Peter is @PeterDoerrie. Thanks for listening, and tune in again next week.